Good morning, everyone. I'm Sarah Taylor. I am with ECU Health, Home Health and Hospice, and I am also a member of the Eastern North Carolina Fall Prevention Coalition. Today we are going to be talking about fall prevention because September is Fall Prevention Awareness Month, and the week September 21st through the 27th is Fall Prevention Week. We have lots of wonderful, exciting programs that are going to be going on, and later in the program, I will give you the website where you can go and engage in all of this information. I would like to introduce to you our specialist in falls, and that is Mr. Dan Hemmings, a physical therapist with ECU Home Health and Hospice, and he's going to be talking about falls. So hi, how are you, Dan?
Well, good morning, Sarah. Thanks for having me, and pleasure to be with you all out there. Yes, it's a very important topic, and I think it's something that we need to spend some time talking about.
Okay, all right. Well, I've got lots of questions prepared for you, and I know that this has become an even more serious problem over the years.
Yes, it has. You know, falls are the leading cause of fatal and non-fatal injuries among older adults. So yes, indeed, it has become a very serious topic.
Wow. So do falls actually impact the hospital system?
Absolutely. You know, as of 2021, the most recent data that I have, 38,000 deaths and emergency departments reported 3 million visits just due to falls alone in older adults. In older adult population, we're talking at least 65 years and older, just to give you a reference point.
Okay, very good. So what is the total number of falls each year?
This is going to surprise a lot of people, but it's actually 36 million falls have occurred in the United States, and that results in about a fall happening every second. Unfortunately, 1 out of every 5 of those falls result in an injury, in, let's say, a fracture or a head injury, and more than 95% of those are hip fractures that are caused by those falls that are happening. Usually when a person is falling sideways. So just kind of give you some information on that, but it's just mind-boggling, the 36 million. I couldn't believe that when I was going over my research and looking at all the things.
Wow. So what does this mean for the adults ages 65 and older?
Well, it means that if we're not going to be proactive about this and try to move forward in talking, as we will discuss, these costs of treating these injuries are going to more than double by the year 2030 to over $101 billion. So it's going to cost not only the patient time and their quality of life will be on the decline, but it's also going to cost us as a healthcare system.
All right. That is totally mind-boggling. So what do you do if you do fall?
Yeah, I think that's a great question. You know, the first thing I thought about was just trying to breathe, stay calm as best you can. A lot of times when a fall happens, thinking about if I'm injured or not, am I hurt or not, if I am to the state that I can get up if I am hurt, or try to crawl if I can, get to a sturdy chair, like a lift chair or a sofa or something to that effect. Obviously, if you are unable to get up, we want to either be using those life alert systems that you may have on you, and or trying to have that cell phone handy in your pocket to call 911, to have the EMS folks come to help you, because we definitely don't want to cause even more injury than the fall has happened. But I think trying to get help as quickly as possible is going to be the best case scenario for you in those times when you do fall and are trying to get to a safe point in your home to either get that help to come as quickly as possible.
Now, in the past, I have heard that you can wear one of those pendants either around your neck or on your arm. Sometimes people put them on the headboard of their bed.
Right.
But I'm just kind of curious, in your opinion, where is the best place to wear that?
I think it's a case-by-case basis, really. If the patient is one that is used to wearing a watch or a timepiece, I think having that on the wrist is appropriate. You just want to have that conversation with that loved one to say, hey, where would you best want this to happen, so that you will know to hit that button. A lot of times if the patient, again, is used to wearing jewelry, a necklace, having that on them in that way like a pendant is perfect. However, I wouldn't recommend having it on that bedpost. That's not the right place to put that, because if you were to have a fall and aren't able to reach it, then it's not really going to help you a whole lot, unfortunately.
Okay. And I know that a lot of families also buy cell phones specifically for their family members. But I've heard that sometimes people don't quite know how to use those. Do you find that in your profession?
Absolutely. The biggest issue with cell phones is they're small, and a lot of times our patients can't see those numbers to call. So trying to find a cellular phone or a even if it's the corded phones with the larger numbers, that's going to be crucial to them getting that help again as quickly as possible. So larger numbers, and or a way that you can use that voice. I know in some homes they have Alexa, the Amazon tool there, or the Google Assist that they can ask that system in their home to call for 911 as well. So that's a great benefit.
Okay, very good. Now, if somebody does have a fall, and let's say that they're really not injured,
Mm-hmm.
is there statistics or anything that state what's the likelihood of them maybe falling again in the future?
Oh yes. So it's going to happen. It's going to basically double the likelihood of them falling again. So the idea that it's normal for me to fall is just a myth. It's not at all true. It's one of those things that's not an active part of the aging process. It's an abnormal part of the aging process. So if you were to fall, definitely talk to your doctor about that for sure, as well as realizing that I've fallen, the likelihood of this happening again is going to double if I'm not going to be proactive. And we're going to talk about those things here, I'm sure, in a minute. So.
Okay. I know, being a caregiver of an elderly person, my dad never wants me to worry about him.
Sure.
So sometimes he doesn't tell me everything. I'll see a bruise on his arm or something. How important is it for family members to be aware that their loved one has fallen?
Oh, this is critical, Sarah. I think just being aware and not going through the motions of, the typical, hey, how are you doing? I'm fine. But taking that extra initiative to engage in your loved one, to whether it's inspecting their skin, just like as you mentioned, with looking at bruises and things like that, and or noticing that maybe they're not walking as well as they were before. You're taking them out to eat, or you're just with them for whatever purpose, but you're just putting on that extra thinking cap to look at them in a different lens, especially if they've had that fall before, realizing that is going to happen again, or it's very likely that it will happen again. So absolutely, and taking that initiative, I think, is very, very important.
Okay, very good. So is there a particular place in or around the home where falls happen mostly? Do you have any statistics?
Where would you guess?
I don't know, maybe coming up the steps from outside?
Yeah, that's a good one. Absolutely. So stair steps, making sure that they're sturdy for one, making sure they have rails. Absolutely. A lot of them are narrow. So again, that's very good. Inside the house, it would be the bathroom. Actually, 80% of falls happen in the bathroom. And what would that be? You know, slippery surfaces, getting out of that shower tub. Also, a bathroom typically has limited space, so it's not very convenient for you to have that rolling walker or assisted device with you as you're trying to navigate that. And I think also just trying to get on and off of the toilet is the other place in the bathroom that happens, unfortunately, a lot. Patients don't have those grab bars and or the toilet seat height to get up and those falls happen.
Okay. So you mentioned the grab bars. Are there other factors that could actually reduce the risks of these falls that people can be proactive in and around their home?
Absolutely. So we talk a lot when we go into the homes about making sure that you don't have those scatter rugs in place, getting those out of the home if possible. Obviously there at the front door you got that welcome mat to wipe your feet and things like that. That's okay. But having just scatter rugs in the kitchen or bathroom, that's a big no-no, just because you can slip and fall on those. Other things would be exposed cords, like extension cords, things like that, or for the phones, a lot of folks have those long cords to charge those cell phones there nearby. Poor lighting. A lot of houses just don't have the light. They may have just one light in their main living space, and that's just not helpful. Clutter, shoes, anything like that could be in the way, boxes. And obviously just a lack of the appropriate equipment. As I mentioned, the rolling walkers, the rollators, the canes, having a wheelchair, things like that in place just to help if they're not able to safely get around, to have that in place. But all those things make a huge difference in preventing falls in the home.
Okay, what about pets?
Yeah, unfortunately our fur babies, as we say, a lot of my patients say that, they are a trip hazard. They're a fall hazard for sure. Even the best, well-maintained ones, we just would, especially when I go in the home to provide physical therapy, just ask that pet would be placed in a place where would not be in the way of doing our session. And a lot of times those pets are put in the bedroom or in a particular place that the patient may have them, so that we can actually work on balance and try to help them on their fall prevention.
Okay, very good. So now, what are some of the risk factors of falling in adults, and someone who may be approaching or are older than age 65?
Yes, so very good. Vision loss, hearing loss, lower body weakness. So if you do not have quadricep strength, meaning in your thighs, if we don't have that strength there, your independence is gone. And so we'll dive into that a little bit more, but basically what that means is you're having difficulty with getting up from a chair, from the toilet, from the car, walking, your balance is off, so that lower body weakness really plays a role there. Certain medication side effects, so we hadn't even touched on that, but yes, medications, majority of those do have side effects of dizziness and or fatigue with medications that you take. So it's a good reminder to check those medications, check those side effects to see what's going on there. That may be a telltale sign that you may have an increased risk of falls and you don't even realize it. And then of course chronic conditions like diabetes, we see a lot of that, and of course arthritis. Okay.
Now, I've also heard that from time to time, if somebody's blood pressure is not being regulated, especially if they get up quick, how would that affect somebody?
Oh yes, so that's a fancy word that we call orthostatic hypotension, and what that entails is exactly what Sarah is alluding to. Your blood pressure is low when sitting, and then when you change positions, such as try to stand, that blood pressure drops suddenly to the extent that you are dizzy, lightheaded, and unfortunately fall. A lot of falls happen because of that. How to regulate that blood pressure? Number one would be, of course, making sure you've taken your medications that involve your blood pressure, and then also maintaining your hydration, making sure that you're getting those fluids, electrolytes. Those things are imperative to you not only getting through your day, but dehydration is a big part of aging and making sure that you've got those fluids to help maintain your blood pressure. So very good question on that.
Well, and you know, you mentioned that the bathroom is the most common place.
Right.
If you're trying to stay hydrated, then of course you're going to be going to the bathroom more.
That's right. That's right.
So I can see where somebody would say, well, I just won't drink as much.
Right.
So I don't have to go to the bathroom as much. But you're saying that that can even be more detrimental.
Absolutely. If you typically, the standard across the board is 64 ounces of water in a day. However, depending on when you go to bed or you're looking to make that transition to your nighttime routine, you want to avoid trying to get fluids in at that time. Typically they say around 2 hours before bedtime you need to stop eating and drinking to avoid having to get up at night to go to the restroom. So if we can potentially implement that, that could play a huge role in preventing falls.
That is very, very interesting. Okay, so we've been talking about ways to, you know, be cognizant of where falls could happen or what might be triggering a fall, the vision, the medications, the balance, just general weakness and things. I guess my next question would be, what are the ways to prevent all of the falls of happening?
Yeah, so prevention is critical, and just with all the information that we've talked about today, prevention is key. And so some ways to do that. With ECU Health, Home Health, and Hospice, we really want to try to focus on making sure that we're keeping you out of the hospital, making sure that you understand the exercises that we're giving you, the walking programs that we're giving you, the balance trainings that we're giving you, so that these kind of things don't happen, that you can have a great quality of life, that we're providing great quality of care to you, as well as making sure that your health and wellness is paramount in all this. So we do that through staying active. We want to make sure that you're trying to get in that 30 minutes a day of activity, whether that's with exercise and or walking, and we provide those programs. Balance training, as I mentioned before, is very, very important, and so we want to implement that as well in combination with what I just talked about. And then looking at if you need an assisted device, what does that look like? You may need a rolling walker, you may need a rollator, you may need just a cane, you may need nothing. It might just be we just need to work on maintenance with trying to get your balance and your strength back. And again, some other things that we look at is in the home. We've talked about where falls happen. So how do we fall-proof your home? And helping and guide you in that, come alongside you to help look at your house and look at those potential fall hazards that are in place and trying to remove those out of the way there. Also, just trying to remind folks to get your vision and hearing checked by your physician. You may have a scheduled time that you do that, so keeping up with that's very important. And then, of course, we talked about talking to your doctor, your pharmacist about your medication side effects. Very important to look at that. Again, big way to help prevent falls with that too. And some things we didn't talk about, but just trying to get enough sleep. I think sleep quality is very overlooked, and we try to do as best we can, give you that knowledge to how can we improve your sleep quality in that, and look at trying to avoid or limit alcohol, especially how that can cause a fall, but actually how that can cause a lot of problems with your medications as well. And then look at making sure you have the appropriate footwear. Footwear is very important, and making sure that if there's bad weather outside, we're not going outside in the elements. If it's wet, slippery, we got the fall coming. We're so thankful for the fall weather coming in here. So, but with what that means is, some inclement weather coming in too. So rain as the winter comes and approaches, and we have some sleet, some things like that. So trying to avoid those things. But I think the biggest thing too is just talking to your doctor, having that relationship with your doctor to talk to them about if you've had a fall, what you need to do. And I think that's where we can come into play. When you talk to your doctor, you could say, I've had a fall, what can I do? And know that we're here to help you with that. So asking your doctor, say, hey, I'd like to have ECU Health, Home Health, and Hospice come out to evaluate me, to help me with my balance, to help me with my weaknesses, look at my house, see if I need any assistive equipment, and we'd be glad to come and help you. We want you to feel part of the family, and it's our job to make sure that we're keeping you well, keeping you safe.
Okay, and I know that you've talked a lot about when you're engaging with your doctor at the doctor's office.
Right.
But let's say that a person ends up in the hospital.
Sure.
And they've been in there for 3 or 4 days. They're really not feeling themselves and stuff. How important is it to ask for home health when they're getting ready to be discharged from the hospital?
Absolutely. There's a lot going on when you're at the hospital, right? And so having, number one, a caregiver that's with you that can be your eyes and ears to advocate for you is very important, as well as, once you have that physician come in, or physicians come in, or nurses come in, just constantly discussing that with those folks to get that kind of, I would hope, kind of permeate into what they're trying to accomplish for you, and having a good discharge plan is vital to that. So talking with the nurse, talking with the doctor about, hey, I really don't feel good about just going home based on how things are in my home, and I'd really like to have ECU Health and Home Health come out to Home Health and Hospice come out and help me, would be a great way to start. And we can provide and get that discharge plan going from there.
Okay. One of the things that I have seen as a trend in our society is that more grandparents are having to raise or care for grandchildren. With that being said, are there any things that we can be doing proactively when engaging with grandchildren? Because I know sometimes let's face it, they're excited, and sometimes they don't put away things.
That's right. So I think playing with your grandchildren is so important to not only you feeling like you can be more active and not kind of putting yourself in a box. A lot of times there's a lot of fear with that, because I'm not as strong as I used to be. I'm a little bit weaker than I was. I'm hesitant to play to the degree that I want to. So trying to balance that's important, but I think engaging as much as you can with your grandkids is so important, not only for the relationship building with your grandkids, but also so that you can add in those things with your grandchildren. Hey, let's pick these things up for grandpa, for grandmother. Let's try to work on these things, and teaching these kids at a young age to work on picking up their toys, to work on trying to help and make it a game. Hey, let's help grandma, grandpa find their shoes, or let's help them. Can you help me down the steps? Can you help me into my car? Can you do these things? And it really makes the grandkids, I think, helps them to feel important, helps them to feel engaged, and they're really being a big help to their loved ones. And I think that makes it all the more just fun for them, but also just you're really building that connection with your grandkids.
Very good. Well, I know that during this month there's going to be a lot of activities, and there's actually a website that is being offered by the North Carolina Fall Prevention Organization. That website is www.ncfallsprevention.org. There, you as a consumer can go out, see what activities are going on, read some of those articles, and even engage in some of the games, the seek and finds or the word searches, different things to help promote your education. So with that being said, I would like to go ahead and conclude this program. Thank you, Dan, for coming.
Thank you for having me.
And if anyone has any questions about fall prevention, the activities that are going on in or around town, contact the ncfallsprevention.org for future information. Thank you. This is Sarah Taylor, and thank you, GPAT, for hosting this show.